Welcome back to the channel. You're in your final stretch now. Week 34 to week 36 of your pregnancy. Your little one is getting ready to meet the world. Let us walk this incredible final week together. You started this journey in your week 1 and today we are already in your week 34 to week 36. If you've been with me through this journey, I really appreciate. Thank you for your time. Thank you for believing in me to walk you through your pregnancy journey. And today we are almost in the final laps. Well done, beautiful mama. So let us go straight to today's topic. Week 34 to 36 of your pregnancy, the body changes, what you're to expect, and the general healthy tips to navigate week 34 to 36 of your pregnancy journey. Please, if you know you've missed our previous weeks, do well to check the description box. I'll be leaving the link to the previous weeks in the description box. So without much being said, let us get over to today's topic. Week 34 to 36 of your pregnancy journey, your baby size, your body changes you experience, and general healthy tips to navigate your week 34 to 36 of your pregnancy. In week 34, your baby is now about 5 pounds if weighed and about 17.7 inches long. And your baby is also growing rapidly. And even if you give birth in this week, everything will be totally fine. Nothing will be wrong with your baby again, just that it will be called preterm labor and your baby will be put in an incubator, but nothing will be wrong if you actually give birth in this week, because the lungs and the central nervous system are already maturing rapidly. They are really matured at this point. So if you give if you give birth at this point, there is nothing totally wrong. Then what you'll be feeling in this week is that sharp pelvic pain below here. Very painful, very painful. I really suffer this pain, but not to worry. The thought that very soon you're going to be seeing your little baby will just keep you moving. It will keep you going, that you might not really feel the pain, but it is really painful. And then that Braxton Hicks will also continue very well in this week 34. The tightening and loosening of your stomach, because your body is ready, waiting for the big day. And please don't forget to always track your baby's kick in this week. Be very vigilant. If there is any change in the rhythm of the baby kicks, call your hospital, call your care provider. Then in week 35, your baby is about 2.5 kg and 18 inches long. And then over to you, your womb will now be likely 15 times bigger than how it used to be. Yes, and the bladder in this week will be very fuller. Every now and then, the urination will become more frequent. God. God, I hope if you're experiencing this right now, please state it in the comment section. How do you feel? The urination, is it funny? Every now and then you have the urge to urinate. You go to the toilet, there's nothing that is coming out. That's because the weight of the baby is already down. So it makes your bladder to full very easily, that you even go to the toilet, there's nothing for you to urinate. So this week the urination will become more frequent. The pelvic pain will become more frequent. Some of us, like me, in this week I will not be able to walk again. I'll be crawling with my leg. And you're also likely to have shortness of breath, or you'll be breathing, you'll be panting, you'll be doing if they ask you to go to a distance that you normally go, you just get tired easily, shortness of breath and everything. But I want you to hold on, be strong, because very soon you see your baby, and that will be a consolation for all the suffering, for all the pregnancy symptoms, the wahala that you experience in your pregnancy journey. So just hold on, because very soon you're going to see your little baby. So please start packing your hospital bag. Don't be, because you don't know when labor will start. If you're yet to pack your hospital bag, what you need in the hospital, your baby's clothes, everything that they gave you as list in the hospital, start packing them, keep them set in one corner. Or you can even go to the hospital if you're this type that you don't want people to know that you're in labor. The day you want to give birth, that just want to walk, people, your neighbor should not notice that anything is happening. At this week, please just take your bag. Now that you're still very strong, take your bag to the hospital. As if you're traveling, just take it to the hospital, because anything can happen from this moment. I gave birth to my daughter in week 36. So, and you know, this is your week 34 to 36. So just pack your hospital bag, take it to the hospital, so that when it starts, there will be no need for you to run here, scatter to start packing things, so that you will not forget anything. Pack your hospital bag, send it to the hospital, and wait for the due day. And finally, for this week, your week 36, your baby is now about 2.7 kg and 18.7 inches long. Your week 36 is mostly considered by most doctors as the early term. Like me, I gave birth to my baby in week 36. She's safe, strong, and sound, very fine. So anything can happen in this your week 36. At week 36, your baby will not turn very well positioned and wait and will be waiting for the due day. So everything is already set in your week 36. So expect anything from your week 36 because everything is ready. The skin, they are already thick, the score, everything is ready to be out. Also in this week 36, pelvic checks might begin. Yes, what I mean by pelvic checks is for them to check your dilation. I remember during my days, I always go to the hospital when I wanted to give birth in my husband's birthday. I went to the hospital for them to check. Dilation actually means the opening of the birth canal, the opening of the cervix for you to give birth. So yeah, for you to give birth for you to give birth, you need the cervix to dilate up to 10 centimeters. So from this week, they can now start checking to know how many centimeters that your cervix has dilated. If you want me to make a video on how delivery process is, you can state it in the comment section. I will tell you what labor is all about and what it entails to give birth. I will make a video on labor and delivery process. So now, what are the healthy things for you in this week 34 to so what are the healthy tips for you in this week 34 to 36 of your pregnancy? Please make sure you stay hydrated, drink a lot of water because it will help in the swelling of your leg. In this week, your legs will not be very swollen because of constant sitting down in one place or the other. Please make sure you also move around. Once you notice that the leg has started swelling up, move around so that it will ease it. And please also make sure you practice your breathing technique because when labor will start, you're not supposed to shout or cry. You're supposed to use your breathing technique, which is you will breathe in and breathe out. You're not supposed to shout. So practice your breathing techniques this period so that when you get to labor room, everything will be made easy. Please also make sure to review your birth plan, ask any question where necessary, call your doctors and ask them any question where necessary. So that's basically all we'll be having in our week 34 to week 36 of your pregnancy journey. Almost there, just a few more weeks to go. So let your body guide you. Trust the process and take it one day at a time because very soon you're going to be hearing the cry of a newborn baby in your house. Please, if you're yet to check our previous weeks, I want you to check the description box. I'll be leaving the links there so that you can watch the previous weeks. And that's basically all for today. If you're just seeing my face for the first time, my name is Daisy Peter. I'm a content creator based in Port Harcourt. I'm a mother of three, and all we do here is give general healthy tips for your pregnancy journey, tips on how to navigate motherhood, and tips on how to take care of your newborn baby. If this resonates with you and it's something you want to be seeing all the time in your screen, please, I want you to like this video, comment, and share this video so that it will get a wider audience. And most importantly, subscribe to this channel. Is absolutely free. This is you telling me thank you for bringing this information to us. Please subscribe to the channel and see you tomorrow in our almost final weeks of your pregnancy journey, which will be week 37 to week 39 of your pregnancy. Please, I'm not a medical doctor. All my teachings here are based on experience and on research. Bye and see you tomorrow in our next week. Bye bye.